Hyperthyroidism. Whenever there is abnormal secretion of the thyroid glands, it leads to hyperthyroidism. Especially whenever there is increase in T4 and lower TSH, this can lead to hyperthyroidism. The major reasons why this hyperthyroidism occurs, we can divide the causes of hyperthyroidism into three different reasons. Number one is Graves' disease. It is a familial disease or genetic disorder where the woman gets affected 10 times more than men. And this Graves' disease is because of the thyroid stimulating antibody, which is similar to that of thyroid stimulating hormone. And if these patients are monitored for a long period of time, they become hypothyroid. It is reported that 20% of the patients becomes hypothyroid on long term. The second reason why the cause of hyperthyroidism is toxic nodular goiter. The thyroid gland is stimulated by the growth receptor stimulating antibody, which leads to excess secretion of T4. Autonomous thyroid adenomas, that is the tumor which is benign, not malignant. The benign tumor of this thyroid gland also leads to increased function of the thyroid gland, which ultimately leads to increased thyroid hormone release. What are the clinical manifestations of hyperthyroidism? Hyperthyroidism causes increase in the metabolism of all the body systems. It causes increased adrenergic activity, especially in the cardiovascular system and the central nervous system. When I say increased adrenergic activity, it causes increase in the heart rate, increased cardiac output, increased palpitation, increased nervousness. All these things can cause increased adrenergic activity whenever there is hyperthyroidism. The other classical symptoms which are especially seen in female are palpitation, excessive sweating, fine tremors, weight loss, intolerance to heat, and in elderly patients, cardiac disorders like atrial fibrillation and congestive cardiac failure. Due to hyperthyroidism, one of the major disorder is Graves' disease. What happens in the Graves' disease is the swelling of the eyelids occurs. Exophthalmic goiter, it is also called as exophthalmic goiter, where there is irritation of the conjunctiva, swelling of the eyelids, protrusion of the eyeball also happens. There may be ophthalmoplegia, that means paralysis of the extraocular muscles. The extraocular muscle function is not proper, which leads to a condition called as ophthalmoplegia. So hyperthyroidism can lead to Graves' disease where the eyelids will not function properly. It can paralyze the extraocular muscles. How to treat hyperthyroidism? There are three major drugs which are used for the treatment of hyperthyroidism. Number one, propylthiouracil at the dose of 300 mg QID, methimazole and carbimazole at the dose of 20 to 60 mg daily. All these three drugs, propylthiouracil, methimazole and carbimazole, they inhibit the oxidation and the coupling reaction in the process of thyroid hormone synthesis. The propylthiouracil has got an additional action on inhibiting the peripheral deiodination of T4 and T3, whereas the carbimazole doesn't do this. Apart from this inhibition of oxidation and coupling, the propylthiouracil also inhibits the peripheral deiodination. It has also got the immunosuppressive action. So the hyperthyroidism can be treated by using these anti-thyroid drugs.